The views and opinions expressed in the following program are those of the participants and do not necessarily reflect those of KSMQ Public Service Media Incorporated or its assigns.
This week on Health Connections, we're talking about healthy kids. We spent some time learning about a recent summer program in Madison, Wisconsin, and also about programs here at home in southern Minnesota. Stay tuned. You're watching Health Connections.
Before I started med school, I actually went to graduate school and got my master's in epidemiology. So I was really trained in studying how diseases were distributed and sort of what the determining factors were and why people got sick. So that's sort of my background. And then I started med school and really had an emphasis on trying to prevent disease before people are getting sick. If we can work upstream and really try to prevent that from happening. So I got involved with a group of med students who work in the Allied Drive neighborhood, which is a low-income, high-diversity housing area in the Madison area, and when we were coming up with programs that we could do to work with the community members and really sort of get people excited about things related to their health and just sort of really get people more aware of their health and sort of factors that they're in control of and how they can change their health outcomes, we ended up coming up with this running program.
Okay.
So, yeah. So the program is called Mile Learn Training Allied Neighborhood. So it's actually a subset of the original Mile Learn Training program,
okay,
which was started by Fleet Feet Sports Madison a few years ago. So.
Okay.
So Mile Learn Training actually was our first year of business, 2005. We wanted to do a program open to people of all ages and all abilities. So we thought 1 mile would be achievable to do in 6 weeks. And so at the time, we had some kids, some adults, and we do it every year from June to July.
Okay.
And it was just really well received. So we continued doing the program, and when we decided to do it this year, we decided to have Mile Learn Training and also mini Mile Learn Training and actually separate the adults from the kids. And that's kind of how we rolled in with Molly, that we thought all the money that we would raise from the program we could put back into the community. And that's how we got involved with the Allied neighborhood.
Very cool.
So they just kind of took our program and we worked together on it.
So what we did, we sort of expanded upon the original Mile Learn Training program, because the original program was just focused on running. So we wanted to expand a little bit more on it and have a health education component along with the running workouts. So we divided the 6 weeks up so that each week had a theme. And some of the themes we did were nutrition and making healthy choices with different, food types. We did hygiene, just really a whole range of topics that were related to the health of these kids and things that they could, control in their life right now. So we had a health education component, and then we would do a workout later after we had done our little activities related to health. It was summertime, so it was hard to get kids to sit down and really try to have some of these discussions about food choices and things like that. But I do think that they walked away at least with the seed planted in their mind that that there are different choices you can make with foods, for instance. And like, for example, actually the grocery store that is really close to the neighborhood had just closed down. So really a lot of the people that are living there right now are going to McDonald's and Walgreens. That's really their only food sources right now. So we said, okay, if you are going to go to McDonald's, what would you choose? Would you choose a McCrispy chicken with extra mayonnaise, or would it be better to choose, like a grilled chicken sandwich? So I do think that they did, walk away with it with, the wheels were spinning, and I think that they were starting to think about these choices. First we started, and we actually did mostly just games that we started out playing, like sharks and minnows or playing tag,
Sure.
Those sort of things, just to really get them sort of, having fun, moving around, and really just sort of also trying to build sort of a team mentality. So really getting kids to interact with each other and sort of work together. And then as the program progressed, we started doing more of, we had a loop that we had marked out around the park. So we started, doing laps around that and, keeping track of, how many laps you had done, and also getting a little math lesson in there for, multiplying, meters by, to figure out, how long the distance was. So we did progress from more of the game playing just to get started with the running to actually then progressing more towards workouts that would really help them complete the mile race at the end. So the race was after, so it was in the 7th week of the program. It was the final week. And it was, during the same time we had an afternoon race, and actually we had Ryan Griesmeyer of Race Day Events, who puts on a lot of the races, like 5K, 10K, triathlon, stuff like that in the Madison area. He came out and he actually put on a race like he usually does. He had, the blow-up finish line and the time clock, and had the PA system. So it was, set up just to be like any sort of a race that you would have, in the Madison area. So the kids got pretty excited about it. I think they were, and when we had numbers that we pinned on them, so they were very excited about it. It turned out to be really fun. Yeah, you could definitely tell as the program went on and as we were getting closer and closer to the race, that kids were, that they were more motivated. They were realizing, man, I really do need to try to, run these couple laps around the park, because otherwise I'm not going to be able to, finish the race, and I don't want anyone, to see me not do my best at the race or anything like that. So you could tell that, as it got down to the crunch time, kids were definitely more motivated. And
Sure.
I think just having it set up, as a big event, all the other kids in the neighborhood were there. I really think that it turned out to be a really good community event. Actually, we ended up, so there were, we had, I think 13 or 14 kids actually complete our 6-week program, but then we also, for the final race, we opened it up to any of the kids in the neighborhood who were there who just wanted to, participate in the race. And then kids who didn't want to participate in the race, they also made, signs and stuff like that to cheer for their friends. So there ended up being, I think, probably about 75 kids that were there.
Wow.
We ended up having over 40 kids finish the race.
Wow.
So it ended up, it was a big participation event. It was pretty cool.
And were there a wide range of times or athletic ability?
Yes, there definitely were. The young boy who finished first, I think, ran like a 6:30 mile, and then the boy who came in last, it was, I think, over 18 minutes.
Okay.
So there was a wide range in ability, a wide range of experience when it came to running, and some of the kids definitely had to walk for parts of it, but they all ended up finishing, and that's
Sure.
what we were really emphasizing, that, obviously, yes, people want to go out and race and have fun with that, but really finishing was what was important to us. I think our youngest participant was 9 years old, and our
Okay.
oldest was 14. Well, it sort of started with a lot, when we work with a lot of these kids, especially over the summer, you see they're wearing flip-flops, and, some of the girls are wearing skirts and stuff like that, which really aren't just, it's not good workout clothes. You don't want to go run around and play if you're wearing flip-flops. So it sort of, stemmed from that, if we could get these kids the proper gear to go out and run, that then, hopefully then this would be a habit that they could continue after our 6-week program. So we actually ended up getting, all the kids that finished the program got a pair of shoes. They also got a pair of athletic shorts and a t-shirt. So hopefully they'd be able to walk away from the program with all the tools that they needed, that then they could go and continue to have, an active lifestyle.
Yeah, they were definitely behind it, but I do think Molly forgot a twist about the shoes that you should add.
Oh, right.
Molly took the shoes to every practice, and they didn't get to take them home with them.
Oh.
So they would have to come to practice, and then when they finished the program and finished the event, that's when they got to take their shoes home.
Wow.
So there was that, you couldn't start the program and not finish it.
Exactly.
So that was kind of a nice added thing that I thought Molly did. But going along with your question about our staff, they were very excited. A couple of our staff actually help coach the other Myler in training, and we have another employee also who does help with Girls on the Run as well. So she's really into that youth running program idea. So.
Yeah, actually, well, I haven't actually spoken to them in the past couple of weeks, but starting, I believe, next week, I'll be seeing them once they're back in school.
Okay.
There's an after-school program that most of them go to within the same Ally Drive neighborhood, so I'll start seeing them again. So I haven't seen them in a couple of weeks, but hopefully I'll start talking to them, and everyone was so excited at the end of the program and talking about how they wanted to do it next year, and hopefully, that their friend could do it next year, and they were all so excited about it. So hopefully when I get back and I start talking to them again, they still have that excitement and are still, hopefully some of them will be wearing their shoes, they can be out, running around in them and stuff. So, yeah, definitely we would like to have it turn into a tradition. I think that there's definitely the need, and I think that there is also the desire for the kids to participate in something like this. And as far as involvement with the UW Medical School, they all seemed very excited with how things turned out, thrilled at the amount of participation we had. If Fleet Feet will still work with us next year, hopefully we'll still have the shoe incentive, because I think that, really kept the kids motivated and really made them, want to finish the whole program and finish the race. So yeah, hopefully next summer we'll have the same program going again. Yeah, a lot of it is just really getting kids exposed to running or to, physical activity, and really starting at a young age, turning it into a habit and a lifestyle, not, some fad diet or some, I just decided to start running and working out for a while and then I stopped. Really try to start, working with kids, get them thinking about these things. You don't have to be a fabulous runner to do this. I run for fun, but I am by no means a fabulous runner. So you can get kids out, get them playing, being active without yourself having to have any sort of, running talent.
My name's Kristi. I'm the fitness director here at the YMCA of Austin. I've been in this position for about 10 months. Health and fitness has been a part of my life since I was fairly young, of being outdoors and doing things and growing up. And then as I went into college, I pursued some running and things like that. So health is very important. It comes from just being here, teaching classes, to my family in general.
I'm the executive director here at the YMCA. My job basically is overseeing, the management of the total operation here. But fitness and living a healthy lifestyle has been a part of my life too. It's actually part of my background within the YMCA as well, because I started out as a fitness director, much like Kristi, and then had the opportunity to move up into more management responsibilities. But so fitness is something that I feel is, and not just fitness, living a healthy lifestyle is really what our objective is in a lot of the programs that we offer here.
At this point right now, we offer swimming lessons, tennis lessons, gymnastic lessons. We do offer a kids fitness program and a preschool fitness program for kids to be involved in.
And we also have incorporated fitness and healthy lifestyle principles into other programs too. So another big program category that we have here is childcare. Basically, anytime school's out, we have childcare opportunities here for the kids in the elementary ages, so kindergarten up through 6th grade or going into 7th grade type of thing. So all summer long we had a lot of children here, and then we also currently right now, when kids are out of school, we have our after school program that monitors them from that, basically 2:45 up until 6 o'clock time that their parents can pick them up. So again, with our objective to kind of encourage healthy lifestyle, we have made it so that our after-school program focuses more on utilizing the resources we have here and getting the kids involved in a lot of different things. So we've made it easy by networking with people in the community to set up through the school district now busing that can come directly to the Y from each of the 4 elementary public schools. And so, and it's at a very modest price. And so any of the children that are here as part of a family membership or a youth membership can access this bus transportation, and that's all they really have to pay for over and above their membership is just the bus route. transportation, and then they get dropped off right at our door. Once they're here, they're involved in large group games. Then a little later in the day, after they have a healthy snack, we've also incorporated with our healthy snack program the opportunity to bring in a nutritionist, either from Hy-Vee or other locations, other resources in town, and then they talk to the kids about some good sound principles of nutrition as well. So again, we're trying to go beyond just fitness and incorporate other things. The other thing we've done for the families, I think that's worked out very nicely, is knowing that they can get their children here safely from this direct route of the bus that drops them right out of the door, and our counselor checks them in and gets them going. Then they're here in that time frame that most parents are still at work, and we've created the opportunity so that if they also want to enroll their child in the swim lessons or the tennis or gymnastics or the youth fitness class, they can do that. They can enroll them, and then our counselors are set up to then get those roster lists and realize, oh, okay, we've got 5 kids that need to be over in the swim lessons at 3:45. So they'll gather them up and get them marching up to the locker room, make sure they get down to the pool for their class, and then that way the parent gets an opportunity to kind of kill 2 birds with 1 stone. They get the child care for their child that they need, but also they know that they're doing something physically active as well as a specific skill while that they're here. So it's really worked out nice that way. The decline in fitness and health for children, everything from the rising rate of childhood obesity and hypertension and diabetes, all of that's become more aware. And we've noticed that even in our enrollment numbers have struggled a little bit over the last probably 5 years. We're not hitting the same numbers we used to. And so, we talked to some of the people in the school district and stuff, why don't we see more of the kids? And, some of their feedback too is that a lot of the kids with their free time, are more content to have more sedentary activity, whether it's video games and that type, and doing things on the computer. So we need to keep working on ways to attract kids and engage them in activity. And so we've seen that pattern of the decline, and now we have seen also more parents expressing concern as well as more interest in helping direct their kids into programs and get them signed up. And right now we're probably best on the elementary age up in towards middle school. It's tougher to draw the youth here that are more from middle school on up into high school, but that's not all bad, because a lot of times there's a lot more opportunities for them for extracurricular activities after school hours, and so there are a lot of them are split up into a lot of those activities, and don't have the need to come to us for as much.
We've been experiencing I have several times I've had from parents to grandparents calling and say, what do you have available for my grandchild or my child that at this point they're noticing there's an increase in weight, there's a lot more sedentary. What can you offer to help them out? At this point, we do a lot of programming for 12 weeks for adults and fitness programs getting started, but I'm starting to notice more parents and grandparents calling, what can I do to get my grandchild or child, get started on a program and things. So a new area that's starting to arise.
I think there's 2 things I wanted to come to mind to respond to that. There's, as far as the National YMCA, one effort that they've been working on is a initiative called Activate America, and it gives guidelines for each YMCA to kind of do their own assessment of how well they're doing in promoting a healthy lifestyle to the community and to their members. And so we've been doing everything from looking at how, when a new member walks in the door, how do we respond to them to create that supportive environment to meet their needs, to get them started on the right foot. And then from there, how do we maintain a relationship with them to again continue to offer that support, not just get them started and say, okay, you're on your own, but how else can we keep checking with you? Kristi was mentioning this 12-week personalized fitness program. That's one element of that. But there's other things that we need to continue to work on. And even our National YMCA says we don't have the recipe book for you to follow that says here's the answers to everything. It's something that there's a bigger challenge out there to get people into an active, healthy lifestyle than anybody can write a recipe book for. So we're continuing to work on it. We're looking to make improvements there to see what we can do to have a bigger impact in the community. And so that's why we've gotten a little bit more involved with things like sponsoring and hosting things like the 5K run that we do in the spring, and we do the hog jog during the 4th of July festivities. We help support the run that was just this past weekend with the Hormel Nature Center run. Kristi got involved with one through the Catholic churches just a few weeks back. And then Kristi was mentioning earlier, we're kicking around the idea that now that kind of tends to focus on adults, although there's a lot of kids that also have been enrolled in those running events. But we're even looking at, well, maybe we could do another neat feature. August is kind of, for the most part, a little bit empty as far as athletic or fitness events in Austin. So we thought, well, maybe we could do something maybe this next year, such as a kids triathlon. There's been an increased interest in that. So those are some of the things we're doing. We still need to look at, continuing to evaluate our programs and see if there's a way that we can create something new that would draw more kids in to keep them more physically active. Sometimes we're hampered a little bit by space, because it's like, do you stop doing swim lessons so you could do a creative, fun thing in the pool? Well, that's hard to justify too. So, you could say that same question for other areas of our building. But I think we need to just continue to explore things, do some surveying of parents, and find out that maybe there's a different twist that we can offer that would draw more kids into a more healthy lifestyle.
One other thing that we do is we do have Healthy Kids Day. That's usually in April, where we have a get-together of having all the kids in the community, whether you're a member or non-member of the Y, come in, be involved in different activities throughout the whole building for several hours, from games and activities to eating healthy and things like that. One thing that we did kick off this summer was we do a Lazy Man triathlon. Well, we did Lazy Kids. So they had so far that they had to swim, bike, and run. We started small. We started with 8 kids, but we can see it growing and getting kids the idea of doing some exercise that way and accomplishing something.
For the most part, again, the YMCA here in Austin is a unique YMCA. Through the underwriting support from the Hormel Company and the Hormel Foundation, they provide 75% of the underwriting cost to offer youth from 2nd grade through 12th grade in the Austin area membership for a year for just $1. And then the other 25% of the funding to meet that is also supported between our annual support campaign that we do each year, as well as the United Way and support that they offer towards that program. So we're very unique in being able to offer every kid in town in, again, that 2nd to 12th grade level an annual membership for $1. And so by doing that, essentially, we're very unique in Austin that almost every kid that's involved in the program is, yes, already a member. There is some children in that category of that fall below 2nd grade into the preschool. And so there you will see some separation of families choosing to get their child in swim lessons and only paying for the swim lesson class and are not actually members. But there's the higher percentage are members because they're involved through their family and such. One other thing that I think that we could make sure everybody is aware of too, I just mentioned a little bit about the uniqueness of the $1 membership. But another thing that we do is we want to make sure that everybody in the community that like to get involved in programs or in the Y and just general membership access has the ability to do that despite income. And so another thing that we do with our annual support campaign that we run in the spring each year when we do the fundraising, we allocate funds so that we have a source of funding to offer families that are in a low-income situation and cannot pay the full rate for that program or the membership that they would like to attain. So then we are able to then look at their income, look at how many people in the household are supported by that income, and then on a sliding fee scale that's approved by our board of directors, say that, hey, look what we can do for you. We can cover 40% of the cost, so only you are looking at 60% of the cost. Will that work for you so we can get you involved? And that's another thing that's been helpful in trying to, again, reach out and get the whole community involved, because we want to make sure everybody has access to utilize the YMCA. It's a community serving organization, and so that's another feature that's out there to help people.
I guess what I see with the kids now is from when I was a kid, you know, outside running around playing and things like that. You just don't see that now. You see kids there, which is good too. There's more structure to their schedules as far as being involved in things. Or, you know, I do see more kids playing the video games and computers, things like that. Definitely seen that how kids have changed in shapes and sizes and things from not being as active as they could be. Again, we're trying here at the Y and in the whole community to make a healthier lifestyle for our kids. I preach from my own home because that comes from my own home. If you ask my own children, I'm very fitness oriented, I'm very health oriented, just being a healthy individual overall.
It's definitely true though that things have changed over the years. I mean, it's like like Kristi was mentioning, there's that change where a lot of children, you know, I mean, we're going a little further back when you say when I was growing up, but I mean, there was a lot more just organized neighborhood get-together play activity that was keeping us physically active, you know, throughout, you know, good chunks of the time, and during the summer months, you know, all day long was kind of spent playing different games and things of that nature. Unfortunately, you see that, but at a much reduced level from what it used to be like. Mm-hmm. And I think part of that's from, you know, the need for both parents to be working, and so there's not a parent home to provide some supervision. You know, and so it's gotten much more structured, and but that's again why we, with our childcare program here, we've tried to make it more than just monitoring kids and doing crafts and doing homework. We want to make sure that it's packed with activity as well, so that they are getting that exercise that they need. You know, we've had fun with introducing the healthy snacks to our after-school program too. When we first made that decision that, hey, you know, we not only have to find food that's economical and fits into the budget, but we need to make the extra step and say, if we believe in living a healthy lifestyle, we've got to provide the healthy snack. And so we started getting creative with that, and it really didn't have a huge impact on our budget to make that change. And the other thing that was positive to see, even more so, is that the kids didn't revolt against the idea of eating healthy food. Mm-hmm. And so it's just been a win-win situation for the kids, and we're fulfilling what we believe in by introducing healthier food for them.